The moment I tell a patient they have a cataract, I instantly see terror in their eyes. They think of needles, pain, and might losing their sight. That is exactly how my patient Laura felt when she first sat in my chair. She almost let the fog steal her vision entirely. But today, Laura is sharing her real, unfiltered journey to show you why you don't need to be afraid. If you or a loved one are facing eye surgery, you need to hear this. To be honest, I had heard about cataracts several times before, but I always chose to look the other way. I never wanted to explore it or learn more about it because every single time that word came up, it was immediately followed by the word surgery. It terrified me. But unfortunately, the day came when the doctor looked at me and said those exact words, "Laura, you have a cataract." Suddenly, I couldn't run from it anymore. Sitting in that chair, my heart racing, I finally had to look him in the eye and ask, "What actually is a cataract?" He told me to think of my eye lens like a raw egg. When you crack open a fresh raw egg, the egg white is completely clear and liquid. Light passes straight through it without any trouble. That is exactly how a healthy eye lens works. It is perfectly transparent, so light can travel through it to form a sharp, vivid picture of the world. But as we get older, the natural proteins inside that lens slowly start to clump together. That clumping is what we call a cataract. It's not a film or a skin growing over your eye. It's actually the lens inside your eye turning cloudy. Like a window that's completely fogged up from a hot shower. Because the light gets blocked and scattered by that fog, everything you look at starts to look dim, smudged, or yellowish. Hearing it explained so simply didn't just make me understand what was happening to my eyes, it made me realize that this wasn't a disease to be punished by, just a natural clouding that needed a simple fix. But then I asked him a question that a lot of you might be wondering right now. I said, "Doctor, I always thought cataracts only happened to people in their 80s and 90s. How am I dealing with this now?" And he completely opened my eyes. He told me that while aging is the biggest culprit, our poor eyes go through so much that it can cause that egg white to cook much earlier in life. For starters, he mentioned diabetes. If your blood sugar levels spike, that extra sugar actually enters the fluid in your eye, making the lens swell up and cloud over way faster than normal. Then there are medications, especially long-term use of steroids, whether they are pills, creams, or asthma inhalers. He even asked me if I had ever had a bad eye injury from a fall or an accident years ago, because a hard blow to the eye can disrupt the lens fibers and spark a cataract that shows up decades later. He explained that exposing our eyes to the sun for years without UV blocking sunglasses plays a massive role. All that intense ultraviolet radiation creates, which silently damages and breaks down the delicate fibers inside our lens. The next cause speeding up cataract formation is long-term use of steroids, whether it's a pill and inhaler for asthma, a simple skin cream, or even prescription eye drops. They can all slowly trigger that cloudiness in your eyes. He also brought up smoking and alcohol, and it really made me think. He explained that smoking pumps harmful chemicals into your body that actively destroy the healthy cells in your eyes. Heavy drinking also does the same. It completely messes with how your eyes absorb nutrients that actively destroy the healthy cells in your eyes, which accelerates that cellular breakdown and speeds up the cloudiness. If a patient undergoes radiation treatment such as X-rays or cancer therapies targeted near the head and upper body, it could also speed up the cataract formation. There are some children born with cataract called congenital cataracts, and they are usually caused by a genetic trait passed down from parents, developmental disorders like Down syndrome, or an infection the mother had during pregnancy. Finally, the day arrived. Modern cataract surgery is so quick and low risk that if you're perfectly healthy, you usually don't need routine blood tests or heart scans. But if you have diabetes, they will absolutely want you to get an FBS fasting blood sugar test. This is because high sugar levels can mess with how your eye heals or increase the risk of infection after surgery. If you have a history of heart disease, high blood pressure, or symptoms like shortness of breath, they will run a quick ECG just to make sure your heart is happy and safe for the procedure. They also scan my eyes to get the exact shape of my cornea and to measure the length of my eye. to confirm the size and power my new customized lens needed to be. In my case, the hospital provided me with the lens and other accessories for the surgery. There were absolutely no injections. All they did was put a few numbing drops right into my eye. That was it, within minutes. My eye was completely numb. I didn't feel a single thing. No cutting, no sharp pains, just a slight gentle pressure and a beautiful display of colorful lights. The entire surgery took less than 15 minutes. Before I even realized we had fully started, the doctor said, "All done, Laura." I couldn't believe it. They placed a protective patch over my eye, and just a few hours later, I was cleared to go home. It felt incredible to leave the clinic so quickly. The important thing was to protect my new lens during those first few critical days. The aftercare rules were actually very simple, but they were non-negotiable. I had to keep that protective shield on, especially when sleeping or napping. I was given a schedule of prescription eye drops. These are a mix of antibiotics to prevent infection and anti-inflammatory drops to help the eye calm down. Putting them in exactly when the doctor told me to was my #1 priority. For the first week, I had to be so careful when washing my face or showering. You want to keep tap water completely out of that healing eye to avoid irritation or bacteria. Take it easy, no heavy lifting, no intense bending over. Definitely no rubbing the eye. The doctor also handed me a dark pair of UV blocking sunglasses and told me to wear them whenever I stepped outside. Right after surgery, your new lens lets in a lot more light than your old cloudy one did, which can make your eyes temporarily super sensitive to brightness. Plus, those UV protected sunglasses acted like a little windshield, keeping dust and wind from blowing into my healing eye. Laura, when did things truly get back to normal? I know so many of you are incredibly excited to know the answer to this. Let me tell you the story. The very next morning, it was time to take the patch off and see the doctor again. Actually, my hands were shaking a little bit. Honestly, my vision was remarkably sharp within 24 to 48 hours, but perfectly normal is a gradual process. For the first few days, things can look a little overly bright, or you might feel a tiny scratchiness, like an eyelash is caught in your eye, which is completely normal while the microscopic incision heals. By day 7, I was back to almost all my regular daily routines, like reading, watching my favorite shows, and taking walks. The doctor gave me the full green light to drive again. Within about 4 to 6 weeks, my eye was completely 100% healed. It was like someone had taken a wet cloth and wiped away 30 years of dust from a window. Looking back, my biggest regret wasn't having the surgery. I let fear steal months of beautiful, clear memories from me, all because of a word that sounded scary. Don't let fear rob you of seeing the faces, the people you love, or the beauty of the world around you. Take that step, book that appointment, and go get your vision back. Trust me, the world is far too beautiful to miss. We are here to help you see the world in full color again. If you love Laura's journey, hit that subscribe button to join our community, and we'll see you in the next video.